हेलो एवरीवन, इस वीडियो में हम डिस्कस करेंगे होमोसिस्टिनूरिया के बारे में, जिसके बाद होमोसिस्टिनूरिया से रिलेटेड सारे केसेस आप बहुत ही इजीली सॉल्व कर लेंगे, इसीलिए ध्यान से सुनिएगा। Coming to the homocystinuria, so it is basically of two types. The first one is the classical homocystinuria, which occurs due to the deficiency of cystathionine beta synthase. The next one is the non-classical homocystinuria, which occurs due to the deficiency of vitamin B9 or B12 or tetrahydrofolate reductase enzyme. Now, before understanding the classical homocystinuria, we will see a small biochemical pathway. So, होता ये है कि homocysteine along with serine in the presence of the enzyme cystathionine beta synthase utilizing vitamin B6, it forms cystathionine. Then cystathionine again in the presence of the enzyme cystathionase, because यहाँ पे breakdown हो रहा है cystathionine का, there comes the enzyme cystathionase. Utilizing vitamin B6, it forms homoserine and the cysteine. So this is the small biochemical pathway which you need to remember. ठीक है, तो होता ये है, ड्यू टू द डिफेक्ट ऑफ द एंजाइम cystathionine beta synthase, there is an increased level of homocysteine in the blood or urine and decreased cysteine synthesis. Discussing about the clinical features of classical homocystinuria, so it is initially asymptomatic, but mental retardation can also be found. Developmental delay is there. Skeletal deformities include the tall stache, long arc palate, pectus carinatum, pectus excavatum. For the knee, genu valgum or genu varum, basically the medial deviation of the tibia, and the pes cavis can also be seen. Scoliosis, which is a sideway curvature of the spine, and for the eye, it is ectopia lentis, which is a dislocation of the lens. And there can also be thromboembolism, which increases the risk factor for atherosclerosis. So these are all the clinical features of classical homocystinuria. Also, the live diagnosis includes one most important test which is often asked. So remember it carefully. It is the cyanide nitroprusside test. So ये जो cyanide nitroprusside test है, if it gives off the magenta color, then the test is positive. We can also go for the gene mutation test or the enzyme studies. And the treatment protocol for homocystinuria includes the cysteine supplementation, restricted methionine diet. We can also give the supplementation of the vitamin B6, vitamin B9 or vitamin B12. Betaine supplementation, which acts as a methyl donor, and therefore methionine can be formed from homocysteine. So these are all about the homocystinuria. So homocystinuria, basically classical homocystinuria is very important. जिसमें आपको जो ध्यान रखना, it is the enzyme which is the cystathionine beta synthase, and the clinical features and the cyanide nitroprusside test. So I hope that I am able to clear this homocystinuria for you all. So if you find my videos helpful, consider subscribing to my YouTube channel Concepts.